It's official. We are recording. My name is Ashley McClure. For anybody I don't know, I'm a primary care internist in Berkeley and Oakland in the East Bay. And I'll go ahead and kick us off. So if you want, the theme today is going to be discussing the 3 statewide campaigns that we are launching with a lot of partnership and teamwork. And we'd love if you want to start off by writing in the chat your name, your pronouns if you want, and where you're joining from. So Amanda.
Awesome. All righty, everyone. Well, thank you all for being here. We're gonna, as Ashley said, we have a lot to cover, so we'll just keep admitting people and running through things. I'm Amanda Milstein. It's lovely to see all of you. I'm a pediatrician. I can now say I practice in Richmond and Oakland and Berkeley because I do a lot of urgent care work, so I'm expanding my horizons, and one of the co-founders of Climate Health Now. We just wanted to start, as we're welcoming everyone in, with grounding ourselves again in our values and what CHN is trying to do and catalyze in terms of bringing the health voices of the California health community to the climate movement. So just, I'm not going to read through all of the details here, but just the high level things. So one, we start with climate health, and you're going to hear a lot about that as we talk about our campaigns, but really grounding ourselves in health, because that's what we know, and that's what we are bringing to the climate movement. Understanding that this is an emergency, and there is a lot of urgency here. That we understand that the science says we need to act now, but that we need to act in a way that promotes equity and centers those who are most impacted. We understand that we are not all affected equally by climate change. Certainly, Californians as a whole are impacted differently from people in other parts of the country and the world. And then within California, we are all impacted differently and unequally by climate change. We value diversity and inclusion. You're going to hear us talk again and again about the California health community. One of the things that we're really working toward within CHN is building a broad tent, a big tent of members of the health community. So we are looking to link arms with everyone who works within health in so many different capacities. Nurses, physicians, pharmacists, medical assistants, people working in, ultrasound technicians, people working in healthcare administration, public health. We really want, in order to leverage our voices and bring about the change that we know so badly is needed, we need a big tent. And so we're gonna keep coming back to that. We act in partnership, and so that's going to come through a lot in what you hear as well today, in terms of how we are aiming to work in coalition on the campaigns that we are engaging in. And one of the core things we'll end with is that we're moving upstream. I think all of us here hopefully understand that really to achieve the change that we know so badly is needed. A lot of that is getting out of our exam rooms, our clinic rooms, our own hospital systems, and really bringing our voices to the larger community. So I'll leave it there. Thanks a lot.
Great, thank you, Amanda. So just to kind of review the goal for this next hour together, our purpose is to kick off our campaigns and share how we pick them, really importantly. And actually, I'm really honored that Deborah Gorman is with us here today because she's one of our advocacy advisory team members. So thanks for joining, Debbie. The process through which we will share that is we'll talk about, the co-leaders of each campaign will give a brief overview of the campaigns and how to get involved. And the outcome goal is that everyone knows who to connect with and how to get involved if something calls to you that you want to join in on. And so how we'll do that, we'll welcome some new members, which I see some joining, which is wonderful. We'll do the overview of each campaign, and then we'll close out and do save the dates for how next steps. So thank you to everybody who is working together for this hour to be high yield and great. So Brenda, thank you for taking attendance. Jess, thank you for monitoring the chat. Angelina, if you would help us keep on time, that'd be great. The timing's up here in the right-hand corner. And then Hannah, if she's with us, I believe is going to be taking notes. So thank you to everybody. Teamwork makes the dream work. And then Brenda, do you want to call out one of our norms for today?
Sure. I'm going to highlight norm number 3, take space and make space, leave space for everyone to contribute. I think this kind of goes with what Amanda was emphasizing with our idea of inclusion and diversity and equity, and making sure that everyone has a space within our community here. And so we welcome everyone to speak up. If it's not using your voice during a meeting, it's in the chat. It's also even emails to us, to the leadership team, to make sure that your voice is heard. And that's it.
Wonderful. I love it. Thank you, Brenda. All right, so I think there's 26 of us, so we don't have, Amanda, you think we should just go to new people?
Let's hear everybody's voice. I think if we can keep it short, it'd be awesome to hear everyone's voice. Let's do it.
Okay, so try to keep track and we'll just popcorn around. So please follow each other as you can, and just very briefly, 10-15 seconds, if you could say your name, pronouns if you want, what type of health work you do, and where you're calling from. So we'll start it off with Hannah.
Sorry, you caught me mid-bite.
All right.
I'm Hannah Bellino. I'm one of the pediatricians. I live in Sacramento, work in the Central Valley, and I work at one of the FQHCs in San Joaquin County.
Awesome. And we'll just jump on in, one person after the next. I don't want to catch you when you can't unmute.
Actually, maybe you should call on people just so is that okay?
Yeah. How about our advocacy advisory team member, Debbie?
Hi all, Debbie Gorman, Green Lighting Institute, she, her pronouns, and we do climate economic work, but it's grounded in the social determinants of health, and I'm coming to you from Oakland.
Woohoo. Thank you, glad you're here. Brett.
Hello, Brett Andrews, Oakland as well. I work in multiple places. I'm currently active in supporting as a co-leader the clean energy transportation investing efforts, and I'm also trying to organize in the American Academy of Neurology.
Thank you. How about Cynthia?
Hi, good morning, everyone, or afternoon. Cynthia Mahoney. I'm a retired nephrologist in Danville and spending most of my time with Voting for Climate and Health, but excited to see the new projects and campaigns here.
Great, thank you. I see Laura's hand is raised. We'll go to you. Thank you.
Hi, Laura, she, her. I don't know if you can see me. I work in Oakland and pediatric surgery. And a first meeting. Excited to hear everybody's voice.
Welcome. Glad you're here. Lily Chen.
Hi, I am a family medicine doctor doing hospice work at Kaiser, and just excited to be meeting. And I'm also active in the Climate Reality Project and have some connections with dental community at University of Pacific Dental School, and trying to advocate for climate, in these settings too.
Great, thank you. We'll go to Gordon. You're unmuted, Gordon, but we can't hear you. Maybe we'll go to Mark Fudernick next and come back to Gordon.
Hi, everybody. I'm Mark Fudernick. I'm an emergency physician living in Pasadena.
Thank you. And Megan Shumway.
Hi, I'm Megan Shumway. I'm a retired nurse, and I'm living in Sacramento and work with multiple climate organizations.
Awesome. Glad you're here. Michael Harris.
Hey, I'm a retired pediatrician, currently living in Bodega Bay on the beautiful Sonoma County coast.
Sounds really nice. We'll go to Alex Reeves. We can't hear you, Alex. There you go.
Hi, Alex Sheriff's family physician in the Central Valley, just south of Fresno, in a rural community. Long interest in air quality issues since the valley is the worst of the worst, and the nexus of climate change and air quality. And it's great to see this group growing.
Yeah, and Alex is one of our Central Valley local hub team leaders. So glad you're here. Angelina.
Hi, I'm Angelique Francione, she, her. I'm an allergist in Davis. Yep.
Awesome. Cindy.
Hi. She, her pronouns. I'm a midwife. I work in a birth center in Berkeley, and I'm also on the NorCal hub.
Awesome. Glad you're here. I can't hear you all, but I hope you can hear me. We'll go to Bonnie Hamilton.
Hi, everyone. Bonnie Hamilton, she, her pronouns. I reside in Fairfield, and I'm a pediatrician, and I wear a number of hats. I'm a delegate to the California Medical Association and also serve on their Council on Legislation. I'm a delegate to the California Democratic Party. I am on the leadership team of the Climate Reality Bay Area chapter, and I also work with local groups, Sustainable Toronto. I'm on their board, and I'm on Toronto Land Trust Climate Committee. So I have a lot of different things. Thank you.
Yeah, I love all the networks here. Gordon, want to try again?
Sure.
There, yeah,
I think you're able to hear me now?
Yes.
Yeah, I think it's my computer defaults to a non-working microphone, so I have to manually change it each and every time I do something. Anyway, I'm an allergist in Sacramento with Kaiser.
Great, thank you for joining. Ilana.
Hi, I'm Ilana in San Francisco. I'm an acupuncturist, and I'm currently in PA school, which is taking up all my time, but also opening up new networks to talk about climate change.
Totally. Great. I'm glad. Congratulations. And then we'll go to Janet Perlman. Can't hear you, Janet. Maybe we'll come back to Janet. Knox, you there?
Hey everyone, I'm Knox Kelly, he, him. I'm a hospitalist in San Francisco, which is where I live.
Great, thank you. And on our NorCal team, right? Let's see, Naomi.
Hi, I'm Naomi. I work in public health and I'm based in Oakland.
Wonderful, welcome. Paulina.
Hi, my name's Paulina. I use she, her pronouns. I work in public health at the intersection of climate change and health equity in Ventura County.
Great, glad you're here. And then we have Vanessa.
Hi, I'm Vanessa Forsyth. She, her, retired school nurse and involved with California Nurses for Environmental Health and Justice, and also Clean Earth for Kids. And I reside in Carlsbad, which is the northern part of San Diego County. SoCal.
Awesome.
Glad to be here.
Yeah, and then we'll go really far north to Wendy.
Oh, hi, everybody. I'm Wendy Ring. I'm in the far north coast up in Humboldt County. I'm a retired family doctor, and I produce a nationally syndicated radio show called Cool Solutions. It's a podcast too about climate action from the bottom up with an emphasis on health. And locally, I'm working on biomass and transit.
Cool. If you want to drop a link to your podcast in the chat, that'd be great. Thanks for joining. And then we have Bill Pevick.
Bill Pevick, retired vascular surgeon, Sacramento.
Wonderful. We'll hear from Bill later, and then Johanna. You can come off mute, maybe. Okay, we come back. Was that everybody? Did everybody get to say hi?
I think Manny just joined. Get Manny.
Oh, hey everyone. Yeah, I just came on. Sorry, I was running a little late.
Do you want to just say where you were located, what you do?
Sure. Manny Berengi, board certified occupational and environmental medicine physician, currently based at VA Long Beach Healthcare System. I also have faculty appointments at UC Irvine Schools of Medicine and Public Health. And I am the lead for academic and community partnerships with the UC Center for Climate, Health, and Equity. So thank you.
Oh, great. All right. Well, we're really glad you're all here. It's really nice to just hear everybody's voice and the diversity of health community members. So we're really glad to see that. So we're running a little behind, so we'll maybe skip this for today, but today's all about the strategy of our campaign. So I'll pass it to Amanda on how our campaigns were chosen.
Okay, awesome. And the reason it was lovely to hear everyone's voice. We are gonna try to speed through this to make up some time. But again, thank you all for being here. Okay, so we're gonna just go through this very quickly in terms of how we got to this point today of what campaigns we're gonna work on. So I think it goes without saying that we all know that there are so many different things that interrelate with climate, the endless number of things that we could engage in and work on. We knew going into this process that we wanted to work on state level legislation and regulation in order to really understand where our health voices could be most powerful and most effective. We brought together our advocacy advisory team. We'll show you who those 6 people are on the next slide. And one of them is on today, Debbie, and really went to them with very specific questions about what is the expected legislative and regulatory landscape in 2023 in California, and where could the voices of health community members be most likely to increase the success of specific legislation passing or regulation being adopted. Over the spring, the AAT met together in a few different ways, both in one-on-ones and as a larger group. We emerged from that with a list of 10 pieces of legislation and regulation that the AAT said they thought would all be worthwhile for us to engage on. From that, our leadership team, which we often refer to ourselves as the transitional leadership team, came together, as well as representatives from each of our 2 local hub teams and our resource team, and looked at this whole list of 10. And from there, we emerged with a ranked list. So figuring out, okay, from 1 to 10, what are the campaigns in which we think we want to engage? And we're going to present those top 3 today. We're not going to go into great detail here, but we just wanted to also flag that we know, especially obviously with legislation in particular, there is a somewhat high chance of legislation either failing or becoming sort of quote unquote a bad bill. So we do have a process by which we will give up on a piece of legislation or stop working on it and move to the next. And we're not going to go into detail on that today, but we have thought that through. Alrighty, so who is on our advocacy advisory team? These 6 awesome people, Jerry Lynn Lopez Mendoza, Linda Rudolph, Deborah Gorman, who's on today, Naila Pope Hardin, Jess Wilson, and Bill McGavern, and they all do different things related to climate, health, and equity policy in California, and have been awesome resources and advisors to us. Alrighty, so what questions did we ask of the advocacy advisory team in trying to figure out which pieces of legislation and regulation were the best sort of fit for us in terms of where to work? So these, I'm not going to go through each question, but I just want to give you all a sense of the types of questions that we asked. So the first one is this piece of legislation or regulation aligned with the U.S. call to action on climate, health, and equity, which is CHN's policy platform. We can share a link to that in the chat if you're not familiar with it, but it's a 10-point policy platform that is widely adopted by different health organizations and medical societies across the US that really calls out actions that the health community can take to protect climate in a variety of different ways. We ask questions along the lines of what are the equity provisions that are built in and what are the equity implications if this piece of legislation or this regulation were to be put in effect. We asked a bunch of other questions in terms of likelihood of success, etc. So this is just to give you all a sense of what was going on. Alrighty, so without further ado, the campaigns that we are launching in on are AB 579, which is pertains to electric school buses. This feels like we should have a drum roll. SB 394, which is called the Master Plan for Climate Resilient Schools. And advocacy to CARB, which is the California Air Resources Board, regarding their clean transportation funding plan and how it will be, how the budget basically will be applied to it.
Wonderful. And then we'll just briefly say that each of these campaigns has a newly launched micro team that's kind of following it most closely to help identify opportunities for Climate Health Now members to participate in the broader coalition working on each of these campaigns. And I'll leave it at that for now. So I'm going to pass it to Angelina and Vanessa, however you want to divide up the time to tell us about AB 579.
Okay, I'll kind of start. I'm Vanessa Forsyth, and the AB 579 was, the sponsor was Assemblymember Ting. I think it was just last week that Shuin got us all organized to meet with his legislative aide and also the Advanced Energy United Group organized for their, what we could do to get this bill passed, because already it was in on the suspense file. So we established a sign-on letter, and we had to kind of organize again quickly. We wanted to establish, we had already submitted a letter, but this was a little bit more detailed in terms of defining bullets, because we got information from Ting's legislative aid and AEU particularly on, what was the problem addressed, and also, the solution, indicating that it was a reasonable solution because it gave 10 years for school districts to gradually, replace their fleet of diesel school buses with electric vehicles. And a big point of emphasis was that there's already benefits and costs, yes, in terms of the health impact, and environmental justice, because most of the impact was for school districts that were more urban, and then also for school districts that were more rural, because kids spent more time on those buses and being exposed to the diesel exhaust. So yeah, but the other thing is that with the Inflation Reduction Act and also existing California funds and CARB going that way, it was all kind of following that, yes, this is something that school districts can do, and there are resources out there. So yeah, it is by 2035, but there is an extension and a lot of support that way for school districts. The biggest group against it was actually the superintendent of schools. Were particularly concerned about the rural buses, but we think that was addressed. So you can see the letter here. We did get sign-ons from in a very short amount of time. The California PTA, California Federation of Teachers, Clean Earth for Kids, CalNED, Bay Area 350, Sustainable Rossmore, and Undaunted K-12. So this letter was directed specifically to Chris Holden, who is the appropriations chair. And he is basically the power broker in deciding, what does or doesn't come off the suspense file. So it was important to also, what Angelina can speak to, getting not only to send the letter and getting the organizational sign-ons, but also she can share something that was important too. If you want to go to the next slide.
Yeah. So just kind of to summarize, basically these bills have to go through committees, and it went through the first committee fine, but because it was expected to cost more than $150,000, it automatically got put onto what's called the suspense file in the appropriations committee. Appropriations is dealing with like money, right? So to get off of that file takes a little bit of a push because there's a lot of bills in that. And if they go into suspense, they basically die and they have to be resurrected again the next legislative session. So in 2 years. And so it was really important that it came out of the suspense file. And they're actually like, this all happened last week, so it's pretty quick. And so we needed to mobilize specifically members in his district, because constituents have more sway than just a random state person or a person who lives in the state calling. And so we were able to use our networks to activate some members there. So thanks you to Mallory and Mark and Melanie, who contacted Chair Holden's office. That was really awesome and really helpful and powerful for you guys to take that action. So now that it's off the suspense file, it's actually going to the General Assembly, and it's actually on the docket for today. So we'll see. We do anticipate it passing just because the Assembly has a lot of members, and generally it should pass since it's gotten this far. However, the next step is then it moves to the Senate committees, and it has to go through the same kind of education and then the appropriations committee in the Senate. And so basically we will need to provide similar support. And so once we are able to identify, like, if there's certain members who seem like they're not on the fence, or there are no votes for this, potentially, that's when we can really use our membership to contact your senators and ask for their support, their state senators. So if you're interested in working specifically on this campaign and being part of our mobilization effort, please give me an email. We can add you to our work group.
Woohoo! Thank you. Yeah, AB 579 team. Wonderful. Yeah, and I dropped Angelina's email in the chat, and thank you both to Vanessa and Angelina and Mark and Melody and Mallory. Awesome. Wonderful. So now I'm going to pass it to Hannah to talk about SB 394.
Hi everyone. So for SB 394, it's very similar to AB 579, except the opposite direction. It's coming from the Senate and it's going towards the Assembly, and it also just got off of the suspense file recently, so the timeline is pretty similar. But this bill is essentially the whole goal of it is to create a master plan for healthy climate resilient schools. So right now there's about 1,000 school districts, 10,000 school facilities, lots of land that the school is on, and all of them produce greenhouse gas emissions. And the school system and the way it has been modernized have not kept up with the changes in the climate. So the purpose of this bill is to create a plan for all of California's public elementary and secondary schools to have a unified path forward in terms of how to meet California's climate goals. So the bill essentially creates this team of people that collaborates with one another, agency stakeholders, to create this master plan, create some priorities, benchmarks, and budget projections for climate resilient schools with an equity lens. So it prioritizes communities that are more disproportionately affected by changes in the climate. It gives some technical guidance, infrastructure, and then allows local schools, ways to access some of the Inflation Reduction Act funding as well in order to modernize some of the schools. There's a huge coalition of folks that are part of this, about 12, a little over a dozen organizations that Climate Health Now is part of. Some of the things that we have done, Amanda has done some of this, is called in directly to our senators to call in as a Me Too, and then we've signed on to a couple of budget support letters as well. And so, like I mentioned, it's just gotten out of the suspense file last week, and now we're waiting for it to move over to the assembly side. Can you do the next slide? So what we need, first, if you haven't identified yourself as part of a particular hub, reach out to your local hub so that they can know who their hub members are. And then we work really closely with the coalition, the Climate Ready Schools Coalition, to help them achieve their goals as well. And so one of their big asks is writing op-eds, particularly in the southern and northern parts of the states. And then as it moves into the assembly, setting up meetings to talk to specific assembly members so that we can move the bill forward. So we would love for folks who are interested to let us know. The schools, I'm a pediatrician, so schools that are super important for where our children are spending their time. And so if you're interested at all, let me know. My email is right there. And then we can find some stuff for you guys to do.
Awesome. And if you have any questions, go ahead and drop them in the chat now, but we will have a couple minutes after we hear from our next one. So thank you very much, Hannah. That was awesome. And now I'll pass it to Jess to talk about CARB.
Awesome. Thank you, Ashley. Hi, everyone. I'm Jess Desjardins. I'm one of the NorCal leadership team hub members and one of the CARB advocacy funding plan co-leaders as well. So the CARB Clean Transportation Funding Plan advocacy is a little unique in that it's not a bill, but that we are actually working to give public comments in the planning cycle for CARB funding plans for the next year. And so what is CARB? In case you haven't heard that acronym before, I hadn't until I started doing this work. CARB is the California Air Resources Board. And so they are, looking at my notes here, the lead agency for climate change programs and oversee all air pollution control efforts in California. And why this is important and why CHN is getting involved is, as you can see on the little pie chart here, transportation accounts for the vast majority of greenhouse gas emissions in California at 38%. So we really can't address climate change, especially in California, without looking at transportation. And this funding plan advocacy is important because this is the annual sort of blueprint for all the clean transportation initiatives going on for the next fiscal year. Last year was about $2.6 billion. And historically, not much of that has been earmarked towards, communities, basically disadvantaged communities, but last year 70% was, thanks to a lot of really awesome work and, people from the community advocating for earmarking those funds. We want to see that happen again. And so basically you can see at the bottom the different clean transportation initiatives and the different multiple priorities there. So obviously zero emission vehicle deployment is really important, but it's also things like setting up bike share programs in different communities and really creating more walkable communities, and particularly in communities that don't get a lot of these funds normally. Next slide, please. So this is the timeline. The workshops start in June, and so there's typically workshops and work groups, and we're going to focus on the work groups, evening community work groups, right, Ash? Yeah, at the top.
Yeah.
So these are from 5 to 7, and we've got the dates over there on the side. And this is for public involvement. You can also go to the different all-day work groups as well. They're 10 to 3, but the evening ones are really for folks from the community to pitch in and give feedback. And so those are, like I said, 5 to 7 p.m. They're all remote. So, really allowing lots of participation there. And CHN is part of a broader Invest in Clean Air coalition, which the website is linked there, but you can also Google it, with tons of different organizations, including CRC, Club, Clean Air California, et cetera, that are all working together on this initiative. And so to prepare our different talking points and our, giving our healthcare voice to different parts of this funding plan, we're going to have a pre-planning meeting on June 8th at 12:30. And so if you want to register for that, you can click the link here. That's just to help us come together, get our thoughts in order. And the first meeting, the first public meeting will be on June 13th, like I said, from 5 to 7 p.m. And I think that's it for me.
Yeah, awesome. So here's the link to register if you want to join. This is just CHN members for 6/8 at 12:30. So if you use this link in the chat, that'll like invite you to that meeting where it's just CHN members kind of teaching each other about why this is important, and then also talking about how to get involved and how to prepare to give comments on that first public meeting where there'll be people from all over the state on the 13th. So hopefully Amanda could, if you could drop you could drop a link to the registration. Oh yeah, there it is. Okay. So Amanda, if you could drop the link to this thing I just accidentally clicked on in the chat, that would be awesome for the 13th. And so what the second link that Amanda's about to put in the chat is just a save the date, because there isn't a way to register yet for the carbs meeting on the June 13th. But if you use the link Amanda's gonna drop, then we will get you that information once it's available. And then the idea is that there's many Climate Health Now members who are speaking at that meeting on June 13th, the statewide virtual meeting, speaking on behalf of clean transportation in the interest of health and equity. So we just shared a lot, y'all. A big round of applause to Jess and Hannah and Angelina and Vanessa for jumping in. And now we are actually spacious on time for questions about these campaigns. Any questions? You can raise your hand or just come off mute if you want.
See, Bill.
There's a lot going on with a lot of moving parts, and I would throw out the suggestion that when something's coming up where we need letters or we need people to speak with assembly members, or we need to attend meetings, we need to write letters, we need to write op-eds, that perhaps we send out an email to all the members and just give us the opportunity, because I personally would be willing to help with all these, but I'm not sure I'm going to sign up for each of these things and be actively involved with each of these because of my other involvement with healthcare sustainability. But I would be delighted to go meet with an assembly member when the time comes, or write a letter and op-ed. So is that in the plans, or if not, could we consider that?
You want to speak to that, Amanda?
Yeah, I mean, I think that is, Bill, your point is extremely well taken. And what we're trying to do is make ways for all of us who are so busy, right, and doing all of these things to engage meaningfully in a way that hopefully has, is effective and has impact. I think that's a great idea. I mean, I think airing on this, it will mean more communication coming from us. I think if we can try to, and I'm saying this to myself because this is literally my job, to make our to streamline things so that if there's a cluster of things that are overlapping with each other, that we email out about them at the same time. Just to kind of keep things from getting a little bit too overwhelming in volume of emails. But I think that's a great idea. Do others share that sentiment, that you'd be willing, even if you're not going to be going all in on one of these bills, to sign things or engage in that way? If we got you notified, if we notified you, yeah, I'm seeing nodding. Okay, awesome.
Yeah, so I think, that's exactly like with these campaigns, is my impression is that using like our database of knowing where people's zip codes are and then knowing who their representatives are is a way that we, in our campaign, kind of use that targeted information to be like, hey, these are the people in this district, please reach out, do this one thing. Because most of the time, if it's something that your representative in general would support, and then they're not like a swing person, they're not on this key committee, then it's not really worth their time to like, you know, try and set up a meeting or try and make a phone call to their office even or something like that. And so I think making sure that your information's updated in Powerbase, so we have like, you know, your zip code. That's exactly what we're trying to do, is trying to do that targeted outreach so that, you know, all us busy people can make a difference where it's most effective. So yeah.
So we can go wide, but also a lot of times it's really more strategic to be very focused. And actually every time people register now, we're getting that info to be able to kind of do either one. So yes. Great point, Bill, and totally agree, Angelina. Vanessa, I see your hand.
Well, I was just going to say that San Diego Unified, it's in the slide, there's a link there about it. That's one of the largest school, or the second largest school district, did pass a resolution to go all electric by 2030. So not just their school buses, but their, you know, all their administrative buildings and school sites. So yeah, and I hear what Bill's saying. I mean, if there's like a general call to action where we need everybody to know, but agree with Angelina's point that it's more the targeted specific you know, legislators that we usually have to get their constituents involved. And that's why it is good the way we have it set up now.
Yeah. I'm sure there will be times where we need everybody too.
Yeah, everybody.
But we want to, you know, we really like, everybody's so busy. So we're just always, of course, trying to balance only asking for people's time when it's really super meets that threshold, you know.
You know,
Bonnie,
Ashley, can I just butt in for a moment?
we go to Bonnie first.
Okay.
Okay, we'll come back to you next, Alex.
Hi, you know, I want to kind of take off on what Bill said. I think the crucial time, unless you're targeting specific legislators, if the bills make it off of the suspense file and go to the floor for a vote, that's when you can get all hands on deck, because all of us have assembly members. Some are going to be more responsive than others, but we can all call our assembly members' office and ask them to please support our bills or the bills that we're concerned about. So I think that there are times when we need to be focused, and you said it too, Ashley, and then there's times that we need all hands on deck. But I understand the balance of sending a lot of emails and so forth. But I do think those times are really important to have everyone involved. Thanks.
So I'm hearing that you're really excited to participate in all of our call to actions. Is that what you're saying? Thank you.
Yes, absolutely. At certain crucial times, I can't be on the,
totally
involved in everything, but I can certainly be involved at the crucial time.
Which is great. I think you're breaking up a little bit, and then we'll go to Alex next.
Thanks. Yeah, there's certain times it's going to be crucial that people really rapidly respond and contact, whether it's an assembly member or whoever. But I really also want to advocate anybody who has a kid in the San Diego Unified School District should be sending them a letter saying thank you for your leadership. And likewise, even if my assembly person doesn't need to be convinced to support it, if they're supporting it, I should send them a note and say thank you for supporting it. And also because that sets up a positive relationship that we can build on in the future when we may be asking them to change their vote or vote in a way that they may not be inclined to. So it's a great opportunity when good happens to pile on.
Totally. Alex, that's one of my mantras right now is practicing gratitude. So, couldn't agree more. And building those relationships is really valuable. So wonderful. So I think, is there maybe one more question on what we've covered so far? And then we'll move to hear about our healthcare sustainability team. Okay, wonderful. We'll pass it to you, Bill.
Thanks. If we go to the next slide, please. So we launched the Healthcare Sustainability Resource Team and had our first meeting on May 16th. And we invited each member to describe what setting they worked and tried to make it broadly inpatient versus outpatient, as there were most everybody worked in a different healthcare system. So doing it by system or location doesn't really help. And then we asked the interested members to suggest some projects that they might want to work on in their workplace. And we're able to organize initially into 5 working groups, with 3 inpatient working groups, 1 working on replacing single-use items, 1 working to optimize instruments and devices on items and surgical trays, and 1 to reduce styrofoam shipping packaging. And then 2 outpatient groups who wanted to work on recycling and or composting and increasing the use of telehealth. And then the next slide. And so we asked each attendee to complete a landscape assessment to find out what's going on at their own institution in their area of interest, to see if there's already efforts going on, see if there's any infrastructure to support such an effort, and then to come back and report on that at our next meeting. We also asked them to do a little introspection and look at what they think might be their specific talents to help them achieve sustainability in the workplace. And we're planning to reconvene the entire group on June 13th at 5 p.m. to get feedback from folks, what they found out about the landscape at their institutions and what they think what powers they can use to advance their efforts. And then we anticipate we'll subsequently meet with individual project subgroups and really try to help shepherd these projects along, and less frequently meet as an entire group. And if you're interested in joining, you can complete the survey listed below and get in touch with either Pam Lee or myself or the leadership, and we can help you join this effort. And that's it.
Oh, thank you, Bill. And yes, shout out to Pam Lee also for being a co-leader of this team. I see a question from Cindy in the chat about, are the meetings always on Tuesday?
You know, that we just arbitrarily chose the first one, and we anticipate having the group meetings less frequently, maybe quarterly, depending on what the progress is on the projects. We think that's going to be requiring more frequent meeting. And it's hard to get a group of 25 or 30 people to all pick a time and a date. Once we get into smaller groups, I think we can be more flexible on when people are available. This may be a bit of one-on-one. It may be, Dr. Jones working at Kaiser Manteca, who's trying to work to get rid of the disposable isolation gowns, and Pam or I helping to make some headway. So we expect this to be iterative, but a fair bit of very personal, specific involvement.
Awesome. Bill, we miraculously have a couple extra minutes. Would you want to speak for a couple of minutes about the JCO letter?
Sure. So this will require a little bit of background. So the Joint Commission, formerly known as JCO, is an accrediting body that accredits healthcare facilities. Turns out there are 3 national healthcare accrediting associations. Joint Commission is one of the 3, but accredits about 80% of facilities in this country. And a couple months ago, they came up with the proposal to require healthcare institutions to measure their energy consumption, both internal energy production and purchase energy, and that carbon output associated, or measure the use of metered dose inhalers, and or work on waste reduction. And there was one more, and they could pick 3 of those 5, and they would have to collect data, come up with a plan to reduce the impact in those areas annually, and report on that. And if they didn't reach their goals, report on why they weren't reaching their goals. And those of us who are interested in sustainability thought this was great and jumped on. And there was a comment period open until May 3rd, and many of us filled out their survey and commented favorably, even made some recommendations of how they could better do this. But a couple days before that, the very end of April, the CEO of the Joint Commission announced that they weren't going to make these criteria mandatory, they were going to be voluntary, and that was because of an overwhelming negative response from hospital administrators. So there has been a bunch of discussion on how to respond to this. A number of the state leaders from the Medical Society Consortium for Climate and Health have organized to try to put together a campaign to continue to support the Joint Commission in these efforts. My read is that's not likely to be successful. The Joint Commission traditionally is an organization that manages clinical care, the stuff we use, the way we treat patients, how we credential, so things like that. They don't really mandate infrastructure things like energy. They don't have a budget to support this. They're mandating these things without providing a budget for struggling institutions to try to comply. I think it's fraught with complications, and as I think it's unlikely would pass legal challenge if a hospital said, I'm not going to do this. They can't pull my accreditation because they want me to do a $200 million retrofit for my energy system. So I think the response from administrators is expected and probably not entirely unreasonable. I'm not sure the Joint Commission is really the one to mandate those kind of parameters. However, the Joint Commission can and should mandate sustainability in the areas of their own purview, which is clinical care. So sustainability for scope 3 things. And so my thought is to take advantage of this change, this pivot in attitude. So the Joint Commission has got a new leader, new CEO who's very interested in sustainability. And I'm afraid if we place all our efforts on trying to get them to go back to this big mandate, which they have already backpedaled on, we'll lose some momentum and they won't do anything. So my recommendation is that we try to encourage the Joint Commission to include sustainability in all of their clinical policies. And just as an aside, they frequently have been anti-sustainability in their clinical policies, very much in favor of things like single-use items without any evidence to support those. So those mandates. So
thank you. I think it's super important and yeah, like you said, expected, but this is the kind of stuff, you know, that is really important for us to all to be involved in and learn about. And so thank you for the update, and CHN will continue to share out updates as we get them. So thanks, Bill, for that surprise request. Awesome synopsis. Amanda, you want to take this?
Sure, and I'm just going to put in the chat again. Sorry, I tend to get very excited about putting things in the chat. There again, if you are a member of CHN and not already signed up to be on the Healthcare Sustainability Resource Team, you can do so there. That's the last link that I just popped in. And anyone is welcome to join. And as you can see, there's such a need for it. This is just if you have colleagues, friends, anyone who is a member of the health community in California, and again, coming back to that big tent, people who are working across and within all sectors of healthcare are welcome to join us. They can do so just by going to our website. I'll pop it in the chat. I want to give a big shout out to Xuan Chang, who's not able to join us today, but who has been amazingly hard at work at updating our website. And yeah, that.
Wonderful. And then also, if y'all want to help in financially, we would also accept that. Amanda is actually doing this as her main job now, and hopefully we'll have more staff soon. So if anybody's looking for a tax benefit or just want to donate, we're also welcoming that all the time. We have a 501c3 fiscal sponsor, so our donations are tax deductible. And we appreciate you even thinking about it. And no donation is too small. Just a latte every month would be wonderful. So thank you for thinking about that. And so many of you probably know Peja Stojic is one of our mentors. Gaurav Basu is an awesome, another climate health leader at the Center for Health Equity Education and Advocacy, affiliated with Harvard and all these institutions. So the third year is just about to start of what's called the Climate Health Organizing Fellowship, CHOF. I did it 1 year with several other CHN members. Xuan did it with Cindy and C. Freeman. and they're just finishing now. And there's another cohort that's just starting. So this is a really, really cool community organizing health climate nexus opportunity. It's a 5 or 6 month long training. It requires 3 Saturday, Sunday, weekend kind of, involvements, all virtual, but Saturday, Sunday from 9 to 1, and then many Fridays from 10 to 12. So it's a really significant time commitment, and it's very high value. So if you're interested in this, Amanda, if you could put a link to it in the chat, that'd be great, because they're looking for people to apply as teams, and they're looking for the letter of interest actually next week. So time is always of the essence, but if that's something that interests you, check it out. And then I'll pass it to Amanda to speak about the consortium's offerings.
Awesome. Alrighty. Yes, that's the website to check out the CHOF Fellowship. If you are interested, the deadline is coming up quite soon, and we're working on pulling together a CHN team. I'm just going to put if you are really interested in being a part of it, you can email me directly at this point. Awesome. And we just wanted to share a few other things here. The consortium, the Med Society Consortium, of which CHN is the California state affiliate, is doing a series of communications workshops that are awesome. I'm going to drop the link in the chat to register for that. I think 2 people actually perhaps on this call are participating. I think Knox and Brett, I think both at least had signed up, and it's not too late to do so. That's the link. You can see there's one specifically on providing public comment. Awesome, Manny, very cool. Yeah, this is super high yield and relevant. I also wanted to just put out a shout out. If you're on Instagram, CHN is on Instagram as well. Huge shout out to Knox for bringing us into whatever century it is. We hear that Instagram is maybe a little more friendly than Twitter, which is not very friendly. So we're excited to be there. Give us a follow at Climate Health Now if you are there. Next slide. All righty. And Alana, you had said in the chat, are we going to send out a summary email with all of these links? 100%. I have a list of all of the links that are going to go out tomorrow. So we will recap all of this, send out all of those email addresses as well for people who are like, who was I supposed to say I was interested in this? So that's all to come soon. We will be sharing the date very soon for our June monthly meeting, as well as sort of what our monthly meetings are going to look like from here on out. For the rest of the year, we're still working on finalizing that, but more to come soon on that. A plug again for the June 13th CARB advocacy opportunity, and again we'll recap that tomorrow. And then I also wanted to share, we'll have more information coming out soon. You've heard a little bit of talk about our local hub teams, of which we have 2, NorCal or Northern California and the Central Valley, and we have leadership teams for both of those, and we'll be sharing out much more information shortly with you all about how members of those hubs will be connected and how you can communicate with each other. So stay tuned. If you think our email is going to spam, let me know. I can try to help you fix that, because we do send quite a bit of email. Thanks for reading it. And a lot of you do read it, we can tell on the back end, so we appreciate it. And yeah, thank you all. This is awesome. And I'll just say, as Ashley said, I literally left my clinical job to do this more or less full time in January, and it has been like the greatest decision I've ever made. So I hope I can keep at it and keep bringing work to you all and work with you all. And thank you for being here and spending your time with us.
Woohoo!
Awesome.
Yeah, we finished early.
And we finished early. Okay, so stay tuned. Oh, go ahead.
Yeah.
Sorry.
Thank you for spending the hour with us. Debbie, as our advocacy advisory team, we really appreciate you joining and your time guiding us, and we will be in touch soon, but we're really glad you all are working with us. So thank you.
Thanks, everyone. Bye, everyone. Take care.
Bye.